Very exciting. Hello, everyone. Welcome. Angela, you ready to kick it off then?
Yes, I am.
Cool.
I'll pass it to you.
Cool. Let's get into it. Hi, everyone. I'm Oliver, Head of Customer Success here at Clearhead. Welcoming everyone today to today's session. Very excited to be hosting Clearhead's fourth webinar of 2022. Today's session is all about maternal mental health, and we're joined with the lovely Angela Lim, of course, and our guest today, Missy Wolfman. Thanks for joining us, Missy. But before we get started, I'll just like to throw in a little housekeeping for all of those lovely folks in the audience. Today's session will run for around 30 to 45 minutes, and we'll make sure there's plenty of time for Q&A at the end. If your video won't be visible to others during the webinar, and your audio is muted by default. If you're using the chat channel to ask questions or whatnot, only your first name is visible to others. So down the bottom on your right-hand corner of your Livestorm screen, there is a general chat function. Although please use the questions tab to ask questions, upvote other questions, and Angela will do her best to answer them throughout the webinar. Click on the polls tab to let us know a little more about yourself. And you can also let us know how you're feeling about today's session by sending us some cute little emojis, which you'll see down the bottom of the screen here. If you are having technical difficulties, let us know in the chat or refer to the troubleshooting guide, which I have posted in the chat channel. If you scroll up, and you should be able to find the link. Otherwise, that's all from me. Thanks again for tuning in, and I'll hand it over to Angela. Thank you.
Amazing. And I believe that Ollie has set through a poll. So it'd be really great if you don't mind putting that through. That helps us understand who's in the room. We will be talking about two very important topics. One is around maternal mental health, and one is around children and adults with ADHD and autism. So by understanding who's in the room, we will be able to know how much more to weight the conversation in terms of where we want to spend most of the time. So welcome, everyone. Thank you so much for joining us here at Clearhead. We're kicking off our monthly webinar, which is very much around speaking with experts to demystify some of the common questions that we get asked all the time here at Clearhead. And as I said, this is two topics that are very big and constantly growing in terms of the request for more information. And so to kick us off, basically, let me just click the record. So to kick us off, basically, it's a pleasure to welcome Dr. Missy Wolfman. She is a clinical psychologist and a mom of twin girls. She's passionate in supporting and empowering people to live their best life. And being a mom with young kids, she knows how hard it can be to be a mom and be a parent. And the struggle is real. So she's the founder of Empower Moms and Empowerment Psychology, which offers assessment and therapy for kids, teens, and adults. Her special focus is on maternal mental health and neurodevelopmental issues such as ADHD and autism. She is based in Auckland, but she sees people all over New Zealand online. So welcome, Missy.
Thank you so much, Angela. Thank you for having me here today.
Well, thank you so much for joining us. Maybe to kick us off, it would be great to kind of hear from you, what got you into this space?
So when I first qualified as a fully registered clinical psychologist, I worked in a child adolescent mental health service at a DHB, and I saw a lot of kids and teenagers, and I got into the space of assessing ADHD and ASD kind of just by accident. They needed a psychologist, so I put my hand up and I got trained and did a lot of assessment and therapy for kids with ADHD and ASD. And then I became a mom and went on maternity leave, and I realized just how neglected moms are in terms of awareness of mental health issues. Often when kids come in, we focus on the kids and what's going on for them, and then we don't really ask the mom or the dad, like, hey, how are you actually doing? And through my own kind of personal struggle, being a mom, adjusting to motherhood, experiencing a lot of quite hard, intense emotions and struggling through that all, And being a clinical psychologist, I thought actually we really need to focus on moms and parents' mental health in order to support children and the whole family. And so that's why I started Empower Moms, and just trying to raise the awareness that it's okay to seek help, and it's okay if you're struggling. It's, you know, part of this journey, and you don't have to be alone.
Amazing. And I think that sometimes when you come from having that personal story, that personal experience, it all seems a lot more real and relatable when people come to you. So why don't you kick off with sharing with us, how do I know if I'm going through, postnatal or prenatal depression and, or even anxiety? So maybe tell us a little bit more about how do I know that I'm struggling?
Yeah, totally. So I'll kind of just describe some terminologies, because I think a lot of people are like, there's so many different terms and I have no idea. Is it perinatal, postnatal, postpartum, antenatal? And so let's kind of discuss the first word, which is perinatal. So someone may have perinatal depression or anxiety, and perinatal just means around pregnancy. So if someone experiences any kind of depressive episode or anxiety episode from pregnancy up until the first year of the child's life, that's what you would describe as a perinatal depression or anxiety. And so you may have heard of antenatal depression or anxiety. So that's depression or anxiety experiencing by someone before the birth of the child, and then postnatal or postpartum, which is after the birth of the child. But the umbrella term is perinatal. So I just want to do the terminology, boring stuff, just in case people are confused. They're like, so many terms out there.
100%. And I think that's the thing, isn't it? It's what you're really saying here is that it can happen at any time. You might go through pregnancy and it's totally fine. And then boom, the child comes out, and then you go through really ups and downs with your mood, or vice versa. You might be really struggling with the pregnancy, coming to terms of like being a mom. Maybe it's an unplanned pregnancy. But then when the child comes, those instincts kick in, and then everything will make sense. So, there is no right or wrong time for your for your mental health to be fluctuating. So thank you for demystifying a little bit around the timing and the terms that gets thrown around.
Yeah, and totally. And even for some moms who have conceived and then may have experienced miscarriage or the death of their infant or baby, you still, this is still the perinatal period. It's a huge, such a massive kind of period of time in terms of transformation, changes. And so mental health issues are more likely to happen around this time. And so I guess the question that you raised is like, how do I know if I have perinatal depression or anxiety? And so the main thing, I guess, is to look in 3 different areas of your life. So the first one is your mood. How are you feeling, right? So if you're feeling really sad, tearful, irritable, angry, so there's changes in mood, and it's very intense compared to your usual self, that's kind of one of the indicators that there may be something going on for you. The other one here is your body and your behavior. So for example, for some moms, they have sleeping difficulties, either more sleep or less sleep. And we can talk a little bit more about how to differentiate that, in terms of depression or just the fact that you have a newborn that's not settling well. Appetite, so changes in appetite. So a lot of moms experience either eating more without any kind of pleasure or wanting to actually eat, but just eating more, or eating less, leading to weight loss. Some moms, they're experiencing anhedonia, which is basically when they're doing the things that previously used to give them pleasure and enjoyment, like catching up with friends or going to yoga or going for a walk. But they don't have that sense of pleasure anymore. Like they don't enjoy it anymore. And that can be a major kind of indicator that something is going on, that you are doing all these things that you previously enjoyed, and then suddenly you're feeling numb, like it's not really giving you that same sense of pleasure or that positive feelings anymore. And then because of that, what we see for a lot of moms who may have either anxiety or depression is that they tend to withdraw, or just in a reduction in kind of activities, whether that's social or engaging in social support, or just, the daily kind of functioning. And so I talked about kind of that body and the behavior. For some moms, they feel quite restless and agitated. And some moms, they may actually be the complete opposite of finding it really hard to get out of bed. Like they're just feeling so lethargic and fatigued. And again, can be quite difficult to differentiate, is this depression or is this the after effects of having a baby and being really tired? Like, how do you know? So that's the second area that you need to look into. The third area is the way that you think about yourself and of the world and of other people. So have there been any kind of changes in the way that you think? For example, are there more thoughts of hopelessness or helplessness or worthlessness, or thoughts that I'm not a good mom, I'm a failure, or I can't do anything right? And for some moms as well, they also have thoughts of suicide, or and not necessarily wanting to die, but more wanting to have this all to end because it's so hard for them to go through right now. So just have a look at all those three areas of your life and see if there have been any significant changes since you've been pregnant, or since you've had the baby, or even later on when your child is 1 or even 2 or older, because it can happen at any time. And if there are any changes, significant changes in those areas, then seek help. You go to your GP, your maternity care providers, obstetrician, midwife, punctured nurse, well child providers. There's so many different professionals who you can reach out to and ask, hey, like I'm feeling like this. I don't know what's going on for me. Can you help? Or can you just figure out if this is normal or not? Is this sleep deprivation or actually something that I should be worried about, like depression or anxiety?
Yeah, one of the things that we hear a lot about is around that guilt, feeling guilty that you're not excited about seeing your child all the time, and that you want a break from your child. And that's really hard for people to process, or like you said, social media isn't very helpful either sometimes, seeing someone with their perfect child outing, all dressed up, and you can't even, get your child to sleep, a full few hours so that you could take a break. There is so much narrative that we tell ourselves, both in terms of the thoughts that we have, whether we're being a good mom or not, or how we're feeling, and then telling ourselves we should feel this way or we should think this way, and then sort of feeling more guilty, and then that becomes a very vicious cycle. So maybe tell us a little bit more about what you alluded to, which is, how do I know when this is just a normal part of being a new mom or the pregnancy, that I am going to not be able to sleep as well because my child's not sleeping, or around feeling tired, and how much is normal fatigue as a response, and how much is this related to my mental health? So it would be great for you to elaborate a little bit more on those 2 points you've mentioned.
Yeah, and I think that's why an assessment with a health professional is really important, because we need to disentangle all these factors, right? And I think that's why possibly, mental health issues like depression and anxiety are underdiagnosed with moms, because you go to your GP and they're like, well, you just have a newborn. Of course, you're going to be sleep deprived and tired. But typically, I guess with sleep, it's for some people who have postnatal depression, even though their baby is settled and have a good sleep routine and actually sleeping, maybe 4 or 5 hours, they have difficulty falling asleep, or they wake up in the middle of the night to breastfeed and then again put the baby to sleep. The baby is sleeping, but then the mom has difficulty falling back asleep. Whereas moms who are not experiencing kind of postnatal depression, usually they're so tired they would just fall asleep really quickly. So sometimes that's what we need to look into in terms of that sleep pattern. Are they waking up before the baby wakes up? And also, how often or how long does it take for the mom to fall back asleep after the baby goes to sleep? So a lot of those questions obviously have to be answered, and again, important to have a pretty good assessment, right? And so making sure that, this is what we're looking for, instead of just the normal effect of having a newborn or a baby.
Yeah, absolutely. And I think that's what you've alluded to before, is that there are multiple different providers that can help you, whether
Mm,
that's your midwife that you have a relationship with through the pregnancy, or whether you
mm,
just want it to be someone that hasn't been involved the whole time. So maybe your GP. The public
mm-hmm,
wait list can be a little bit difficult. So being able to rely on your employer's EAP system like Clearhead, being able to kind of
mm-hmm.
get access to private support as well is important. If you feel you're struggling, getting on top of these things will help
Yes,
you sort of be able to deal with it.
yes.
Let's get a little bit deeper into maybe a bit more of the thorny side of things. You know, um, we've recently introduced legislation around providing leave for moms who have experienced a miscarriage. And that's because we're finally recognizing as a society that this has huge ramification in the couple unit, and on
Mm,
the mental health of the mom who's been carrying the child, and have a lot of
yeah,
hopes and dreams associated with that, right? So tell us a
yeah.
little bit more around what you see in your clinical practice around how do you deal with the grief if you have
Mm,
a miscarriage or stillbirth. Yeah.
yeah, yeah. Um, I think a couple of important points that I always try to talk to my clients is that there is no right way to grieve over a miscarriage or a stillbirth, or the loss of a baby or a child. And there's no deadline on grieving either. A lot of my clients come to me and they said, oh, it happened 3 or 4 years ago. Like, I should be over this by now. And it's actually, there is no deadline, right? There is no kind of time frame that someone says you should be done grieving. And a lot of moms, they feel like they can't grieve for the loss of their baby or a miscarriage once they get pregnant again and successfully have another child, because they're like, look, I have another healthy baby now. And again, that's another myth. Once you've lost a baby, once you lost, a child, it's a big loss. It's a massive loss. And so what I always try to ask my clients is to really focus on the importance of connection, because what happens when we're experiencing trauma, like psychological trauma and psychological wound, is that we typically try to hide away, right? And we try to hide away and try to push people away, which is a pretty common, normal, typical reaction in dealing with grief. But we know from a lot of research in terms of resilience and recovering from psychological trauma or any kind of horrendous event in your life is the healing power of connecting with other people. It doesn't have to be your partner, it doesn't have to be your family, but just connection is so important. And it may also even be with pets or animals or through nature. But connection is what heals people, not disconnection. And so again, there's no right way to deal with grief. But if we can just focus on this connection part, I think that would make it easier to recover. And the other point that I always like to talk to my clients is that what they've experienced is a psychological trauma, right? Psychological wound. And so how would you treat yourself? Let's say if you had a physical wound or physical trauma, right? Once you've had like a major injury, you're like, my brother-in-law had a knee surgery and he's been in crutches and things like that. And like, he was taking care of his injury. People were looking after him. He was seeking support. He was getting, professional help. He's doing rehabilitation and those things. And it's the same thing for psychological trauma and psychological wounds. We need to have that same self-care and compassion to ourselves as if we were, having a physical wound, physical trauma. But a lot of people kind of think, well, I look fine, so I'm okay. So I'm going to get on with my life ASAP, which is, can be unhealthy sometimes, especially if you don't allow yourself that time, right, to process and grieve.
Absolutely. And I think just to kind of give people a sense of context, so somewhere between 15 to 30% of new moms will go through some level of postnatal depression or anxiety. And in terms of miscarriage, somewhere between 10 to 15% of pregnancy will lead to a miscarriage, especially mostly in the first trimester. So these are not insignificant proportions, you probably might know someone, but it's just something that just doesn't get talked about. And so it's really important to highlight that this is common, and you're not a failure for experiencing any of these issues. So talking about sort of psychological trauma, one of the things that they have mentioned about psychological trauma is actually the impact of COVID-19 on people.
Yeah.
So do you want to share a little bit more about, has things changed in what you see in the clinical practice pre-pandemic and post-pandemic around maternal mental health?
Yeah, significantly huge. Oh gosh, where do I start? As everyone have experienced with lockdowns and restrictions, it adds those extra cumulative layers of stress, and then in particular for parents who are juggling with working, as well as taking care of their children and homeschooling. And even now that we're in orange setting and, not in a major lockdown, there's still families dotted around New Zealand all over who are in their own mini lockdown, experiencing that, again, constant stress of having to juggle everything. And so we definitely have seen a huge increase in people reaching out for help. We know that there's been increase in psychological distress, anxiety, depression. I'm sure you can also look at the stats in Clearhead in terms of how many referrals and how many inquiries have come through from 2020 to 2022, right? But I think, again, looking back to what I said about connection, I think the major kind of impact that COVID-19 has had is that disconnection, that, sometimes we feel like we're connected and we're supported by everyone, and then suddenly we're in our own mini lockdown and feeling really alone and isolated and just overwhelmed. And for a lot of families in New Zealand as well, prior to this year when the border opened, there is an actual physical disconnection with other family members who are overseas. And I know a lot of parents or moms who, don't have any family support because their parents are overseas and their children haven't seen their grandparents for 3 or 4 years. And so there's a lot of that cumulative effect of stress that I think we're really kind of seeing the impact of it now. And a lot of people, they, try to go through the motions during lockdowns and thinking everything is okay. And then, now that we're kind of back to normality, suddenly just going, what just happened, and realizing there's been massive kind of, psychological trauma that a lot of people have experienced. And therefore they're reaching out for help, which is really great to see.
Yes, we definitely had seen a big jump, and I think something like 8 times more people requesting for professional help, which is very lucky for us that we do have funding available to provide them with that support. Talking about that trauma situation and the impact of juggling all these stresses, one of the most common stresses that we hear about is basically, does my child have ADHD? Does my child have autism? Especially again, if you're a new mom, they're sort of coming into they're no longer that restful baby stage, and now you're trying to see if they're integrating well into society. And would love to hear your thoughts on what are the common questions that you hear from people coming to you for ADHD or autism assessment?
Yeah. So I guess a lot of parents are inquiring, like, does my child have ADHD? Like, he can't sit still, he can't concentrate. It's really hard to get him to do homework. And actually COVID-19, with lockdowns and homeschooling, a lot of parents are asking those questions because they're like, I'm trying to teach my kids and they're not concentrating, right? And a lot of them, they're like, oh, wow, I can actually see what my kids' teachers have been talking about for the last 5 years. I can see it now here at home because they really have difficulty, staying on task, concentrating, doing their schoolwork. So a lot of them are asking those questions because they're observing their children more, and then also trying to figure out, is this normal? Is this developmentally appropriate? Is this an age and stage thing? Because if we look at neurodevelopmental conditions like ADHD and ASD, obviously it's a condition that affects the brain development. And what that means is that typically you would see there's a qualitative difference between a child who has ADHD, let's say at the age of 6, compared to children, other children who are also 6 years old without ADHD. And in those areas of, concentration, being able to stay on task, focusing, being able to sit still, following instructions. And so I guess the most important thing here to raise is that, everyone has a lot of hyperactivity, impulsivity, inattentive symptoms some of the time in different settings, but the main thing that we're looking for in terms of assessment is whether this is developmentally appropriate, and whether it's impacting on their functioning. And so I guess for parents, if they're concerned, the main thing is to basically start gathering information from other adults around your child, like your child's teacher, pediatrician, GP, well child provider, because the more eyes that you have around a child, and these are professionals who see, numerous children all the time, they can give you an impression of whether this is something to be concerned about, in terms of inability to sit still or hyperactivity, etc., or whether this is developmentally appropriate. Like my, 3.5-year-old twin daughters, they are running around and jumping off the couch and things like that. That's pretty normal for 3.5-year-olds, but maybe not so much for like a 9-year-old, So that's the main thing that you need to ask yourself. Is this what you would typically expect for someone their age?
Yeah, absolutely. Having a good understanding of developmental stages is not something that most parents are taught and the one of the most common ways you could ask for a little bit of input is just their teachers around you, and their GPs that have been seeing the progress of their child, and then also recognizing that there will still be individual variance. It doesn't mean that just because this person is a little bit more active than for their stage and age doesn't mean that we will have to pathologize this and say, okay, this person has ADHD either. That's really helpful. And one of the things that we hear, obviously, is the very long wait time, especially as those demands go up when parents are suddenly realizing, oh, this child of mine might not be concentrating as well. And there are obviously environmental factors. It is just harder to concentrate looking at a screen
online
than it would be in a classroom, for example. So really, again, understanding how much of this is situational to COVID and the pandemic. But other than sort of reaching out to the people around them to get a sense of what normal might be, are there any other support systems that we should you can encourage parents to put in place to support their child?
Okay. So I think that's why that formal assessment will be super important, because in New Zealand, a lot of that support services, well, the government funded ones anyway, are only accessible by through a formal diagnosis, right? And so it's important to have that assessment, not just to get that support, but also to identify the areas of strength that your child has, as well as the areas of need, and therefore finding out what support is required to scaffold your child. And so the way that I kind of see it is that, if you see like an onion, right, like a child is in the center of it, but you need to layer on support across the system as well. So for the child, it may be individual therapy or kind of more specific support at school, for example, like a teacher aide. And then for the parent, it may be that they need more kind of parenting support in terms of parenting programs or kind of parent like coaching, because parenting kids with neurodiversity or neurodevelopmental condition can be extra challenging, as well as getting them maybe extra childcare or respite, so then they are reducing their level of burnout, and then layering on top of that the school system. Are there any support that can be put in place in the classroom, within the school? And again, it's just quite a complex kind of way of looking at it, but I think that's the best way to make sure that not just the child is supported, but everyone that's within that child's system is also supported. And again, through only kind of formal assessment, I think that you can actually get those in place. Specifically things like, teacher aid or RTLB funding, or those things can only be accessed if your child has a diagnosis.
Yeah, and that sounds really good, being able to access therapy, additional support for the child and
Mm-hmm.
the parent themselves. What is the
Mm-hmm.
role of medication in all of this as a form of support? Do you have any thoughts on that?
Yeah, and so for ADHD, we know that medication can help some children. In terms of evidence-based guideline, I think for children under the age of 6, we're trying to have behavioral therapy or behavioral support in place before trialing medication. Obviously, there are side effects with ADHD medication, like reduced appetite, that may impact on their development and growth. And so you need to kind of weigh up the pros and cons. But for some kids who have been diagnosed with ADHD, may benefit from, trialing ADHD medication in conjunction with all those layering of support that I've just described. But medication alone, is not going to do much if we don't have all those layers of support. But they definitely play a role.
Wonderful. And I think that's the thing that we often want to kind of ensure that people understand, is that there is no silver bullet with mental health challenges and
Yeah.
neurodevelopmental issues. It's
Yeah.
very much making sure that resilience is built through an environmental and individual level, basically.
Yeah.
And if you could share with us as well, because one of the things that we are seeing quite a bit is adult ADHD. And
Yeah.
I've heard that you've had a big increase in sort of assessment from adults
Mm.
wanting to know if they have ADHD, that maybe back when they were younger, that was just not in vogue. And
Yeah.
so they were never assessed properly. Do you want to
Yeah.
share a little bit more about what adult ADHD might look like, and when someone
Mm-hmm.
should get assessed or not?
Yeah, yeah. And so ADHD, again, it's a neurodevelopmental condition. So the symptoms of hyperactivity, impulsivity, inattention should have been present across the adult's lifetime. So it's not just because this year they're, in a new job and therefore experiencing a lot of attention difficulties. So that's why the assessment process can be quite long and very thorough, because we need to get that really good developmental history to make sure that these are symptoms that have been persistent across their lifespan. But the reason why I think it's so difficult to detect, I guess, for adults is because, again, it's a developmental age and stage thing. So a lot of adults with ADHD, they recall childhood where, they were called the naughty one, or they look at school reports and all their teachers said, oh, if so-and-so just, apply themselves, then they would get an A, or, blah, 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 is always distracted and talking to other kids. So that kind of presentation. But obviously, as someone matures and their brain develops, they're able to maybe sit still, actually do work, do all those things, but it's just more difficult and more challenging. And so the kind of typical kind of presentation of ADHD that you would see in children, obviously you don't see that in adults as much anymore, right? Typically the adults can, do work, but they just struggle to, concentrate for longer than 20 minutes, or they get easily distracted, or they can start a project but then find it really hard to finish a project, or those things that are not so as easily observed from outsiders, and that's why it can be a little bit more difficult to assess in adulthood. But again, there are lots of kind of self-questionnaires or, screener that you can find online. And a lot of people have been doing that, and they're like, oh, okay, like I need to get an assessment for ADHD. So that may be something that you want to do as well, if you feel like that has been impacting on your life and been, ongoing for your whole life as well.
Yeah. And so ultimately, what we're really sort of suggesting is that if you're struggling, don't forget to ask for help. And the other thing is that your social connections are really important in providing you that support, whether that's in helping you identify that you're struggling, or when you are struggling, to make sure that you have a support structure to lean on. So we've been chatting for 30 minutes now. It's been really great to deep dive into two very massive topics. And so for the next 5 to 10 minutes, we'll just kind of go to audience questions. And we have one, which is very much around, in your experience, have you had new dads that have developed mental health issues? of course, we talked about maternal mental health, but
Yeah.
do you see it in new dads as well?
Yeah, totally. That's one of the points that I wrote in my notes, like, don't forget the dads. So thank you for raising that, because, I think a lot of the time dads feel quite neglected and forgotten as well. And we know from research that, dads are more likely to experience mental health issues if their wife is also experiencing mental health issues. Yeah, definitely. The postnatal depression in terms of a formal diagnosis can't be applied to dads just of a technicality, but obviously dads could experience depression and anxiety at any stage of their parenthood journey. And we definitely see that. And I think there is an organization, I'm trying to remember the name of it, where trying to promote kind of that awareness of mental health issues and new dads and getting them support as well. But again, like when we're talking about the family system, right? Like when there's someone struggling with their mental health issues, it's going to affect everybody, right, in that family unit. So we talked about neurodiversity or neurodevelopmental condition for the child impacting on the family system. It's the same thing for moms or dads, and that's why it's so important to seek help. With dads, some of the kind of symptoms may not be as kind of obvious for a lot of dads. They may kind of plunge themselves into work, for example, in their kind of new fatherhood time. And so they may not actually kind of feel like they meet any of those criteria, but that it's also really important to kind of reflect and be like, okay, hey, how am I doing? There's been massive transition in my family system, and is there any support that I need to get or try to get? Because it is a significant adjustment and significant stress.
Yes, and one of the other questions that have come through is very much around this idea behind that actually might be misdiagnosis of ADHD when it's much more complex developmental trauma, childhood trauma that has occurred.
Yeah.
How do you tease that out? Do you have any advice, I guess, for either parents or people supporting their, it might be that they might be a grandparent, for example, or they might be a teacher. How do they know if potentially a child is acting out and the easy label is, oh, this child has ADHD, versus actually there's more complex issues happening at home? How would you sort of advise these people in the periphery?
Yeah. I guess in terms of teasing that out with the developmental trauma or what's going on in life or versus by ADHD, that's been this ongoing huge research and debate in clinicians and researchers, right? Like in terms of differentiating those two things. But I guess in terms of assessment, what we need to do is having that thorough timeline and thorough developmental history. But in terms of the people who are supporting the child, is that, the main thing is like always kind of approaching someone's difficulties with compassion, right? Compassion rather than putting a label or putting blame on them. Even if a child may be diagnosed with ADHD, hopefully that should help is that to have that empathy and compassion of the difficulties, the struggle that the child has, that they cannot kind of necessarily control what they're doing, right? And even like say if they're acting out because of life circumstances, that in of itself is saying something, right? They're struggling, that there's been a lot of challenges and difficulties. So I think just having that compassionate lens of and that kind of inquiring, like, okay, what else is going on in this child's life is super important for everybody, teachers, parents, grandparents, everyone, not just kind of quickly assume something, right? There's always so many different variables and factors that come into play.
Absolutely. So it's really about saying that, can we give the child a space to share what's going on with them, giving them permission? Because often children do take on this perspective that it's their fault,
Yeah.
even in the context of childhood abuse,
Yeah.
that the child thinks that they brought it on themselves, and giving people or children a space in which you could have the ability to share and share in a safe space. We can do a lot as safety net outside of the core nuclear family unit. I sort of really would love to kind of hear any final thoughts that you have, Missy, that you want to share with our audience before we close it off today.
No, I think I just want to emphasize again, we've covered, more kind of clinical depression or clinical anxiety, but it doesn't matter. Like, if you look at those symptom checklists and you're like, actually, like, I don't meet any of those for depression or anxiety, but I feel like I'm struggling. It's so important to reach out and to get the help that you need, whether that's, through a trained health professional or just to friends and family. Because we know that the earlier that you reach out and, again, seek that connection, the more able that you kind of bounce back and be resilient. So really, it's just all about kind of checking in with yourself. How am I doing? And then making sure that you get that connection and support.
That's wonderful. And I also know that there's quite a few therapists in the audience who have very specific questions around the training pathway. And we might shoot those questions to you separately so that you could just send us back an email response to them. Otherwise, it might be too specific for the wider audience today. But thank you so much for sharing your thoughts. We have dive really deep on very complex issues that just is very hidden in society. But really, the takeaway is, if you're struggling, just ask for help. Don't feel guilty. Don't feel bad. Give a space for your child. Give a space for yourself. And we're here to support. And so thank you, everyone, for taking the time to attend our session today. And we wish you a very lovely rest of your day. Thank you.
Thank you so much.